really was a welcome announcement yesterday by the TGA that they have approved the Moderna vaccine for children to 5 years, because we do know that children in this age group can experience severe disease, and that's healthy children, not just children with certain underlying medical conditions.
So you're a mum yourself, I understand. What's going to be your approach?
Yes, I have 4 children. Mine are a little bit older than this age group, but, we're certainly at the moment seeing a lot of COVID in the community. We are needing to step up and really use those mitigation measures that we're also familiar with now with masks. But vaccination is the cornerstone, and this age group we have been wanting to protect. We know that these children, as I said, can be admitted to hospital with more severe disease. We are concerned about children who are at higher risk with certain underlying medical conditions. We know that kids can also develop multi-system inflammatory syndrome, which is the more severe version of COVID in children. And of course, we know that there is a risk of more chronic symptoms or long COVID in children, although that risk is small. And then, of course, there are the indirect benefits as well with children, of course, if they're not getting infected. Being able to go to kindergarten and childcare, and of course for their parents to continue to work. So there are many direct and indirect benefits for vaccinating this age group, but we know that this is going to be challenging for some parents to make this decision. We've all seen that the coverage in the 5 to 11 age group has stalled in the last few months. So I think, it's up to us as clinicians, doctors, scientists to really help parents to understand the benefit of vaccinating children in this age group, and balance that against the very small risks.
Yeah, Margie, you're an expert in vaccine uptake, not just in children but in adults. It's below what officials were hoping. I just had my 4th vaccine last week, but there are so many Australians who haven't had their 3rd.
Absolutely. And as I said, this has been a particular challenge for primary school children to really lift that coverage up. And there's a number of reasons for that. Obviously, we know that a lot of children have experienced COVID in the Omicron wave since January, and many parents are questioning, well, if my child has had COVID, why should I get them vaccinated? But actually, it's very clear that hybrid immunity or protection from infection and vaccination together provides the best long-term protection. And as I said, we know that children can get severe disease even though that risk is low. So we really need to help parents to understand the benefits and the risks, the common and expected side effects are similar to the primary school age group or even the young adults, a sore arm, headache, fatigue. And fortunately, the risk of more severe side effects, such as myocarditis, are extremely low in this age group. And in fact, there were none detected in the clinical trial.
All right, Margie Danchin, you've given people watching this morning a lot to think about. Thank you.